Hi there. Today I will talk about another care-related software. It is Care Audit Pro. I can't ignore the requests anymore. Just too many clients ask for this video. So I'll show you its features, how it works. So hopefully you and your team can understand Care Audit Pro better. So Care Audit Pro, it's not hard to guess. It's a care compliance software, auditing tool, and many other features. I am now sharing my screen. So we have audits, surveys, and many other features, which I'll be talking about. But let's start with the audits. So far we have care homes, domiciliary care, and supported living. If you want to purchase any of them, you click on the type of business that you want. So I'll start with care homes, go to audits. I am prompted with the features and the pricing, and this is the subscribe button. You subscribe, and then this will create an account, and it will give you access to the dashboard. So let me log in, and then I'll show you how the dashboard looks like. Also, sorry, it's the same with surveys. You select which surveys you want to purchase, and then you subscribe. Subscribe here. Okay, so let me log in. I've logged in now. I've been redirected to my dashboard after I made the purchase. This is where you'll spend most of the time, in the calendar section and audit section. Once you're redirected, this is where you will see your purchases. This is a demo account, so I purchased all three categories. So I have audits for care homes, domiciliary care, and supported living. In your case, it will only show the one that you purchased. On the left-hand side, you have the dashboard. I will start with departments. We allow all the users to create their own departments. So this is fully customizable. I'm gonna pretend I'm a care home owner, so I created this departments. Then I'm gonna go to the user section. I'm starting with this one because this is the hard part, and this is where a lot of customers get confused. So I'll start from top to bottom. The highlighted one, invite users from departments. So it says here you can allocate tasks to these users. They will be able to see the tasks and action them. So you carry out the audits. AI will give you an action plan, and you can create tasks after you completed those audits. You can share those tasks with your team members. So if you invite these users from departments, they cannot do anything else. So they can carry out audits, they can manage surveys, they can't do anything but action the tasks that you allocated to them. So this is the most basic type of user you can invite to the platform. Again, all they can do, log in, they'll be prompted with a dashboard. I'll show you their dashboard as well. And they complete the tasks. They can upload evidence, write notes, and mark tasks as completed. But I'll show you everything the right time. The next type of user is the maintenance person. You invite a maintenance person, they will have their own dashboard as well. The maintenance person will be able to carry out audits related to their role. So you can allocate, just let me click on it. So I have the full name, job role will be maintenance, their email address, and from the audits, I can select the audits relevant to the maintenance team, and then send the invite. They'll receive an email, they create an account, and then log in into their dashboard where they can manage the audits, carry out audits, share the tasks with the team. Also, they can complete tasks themselves. Beside that, we have the maintenance feature, which is in testing phase in beta. You create a QR code, you display it through your home. Staff, visitors, anybody can scan the QR code and report an issue. And you have statuses for all issues, so you can see open, in progress, and completed. Your maintenance person will be able to manage all the issues, mark them as completed or in progress, upload evidence, and you'll track here all the issues reported and you'll see their status. That's the maintenance person in a nutshell, but we'll be logging in into their dashboard, so you'll see how it looks like. Then you have head office users. It says here, invite head office supervisors with full administrative access across your account. So basically, this type of account will mimic the main account, the main account holder. So head office staff can see and they can do everything you can do. This is useful for multi-site businesses because head office users, once invited, so let's say you have 10 care homes, 10 sites, every care home will invite the head office user. That head office user, when they log in into the dashboard, they can toggle between all the 10 sites. So they can jump from one site to another and see everything and control everything. So yeah, this is useful for multi-site businesses. But not only that, even if you are if you have one site, one care home, maybe you want your head office, your directors to see what's happening in their business, so you can invite them using this type of user. Then you have the auditor, straightforward, invite internal auditors to complete selected audits on your behalf. So, for example, deputy manager, care coordinator, chef, head of domestic, head of HR, head of recruitment, because when you click on it, again, you have the name, role, email address, and then you select the relevant audits to their role. And when they log in, they'll be able to see only the audits that you allocated to them. They complete the audits and they distribute the tasks to other team members, but they can complete the tasks themselves. So this is the department and the user tabs. It gives you, this means with these two tabs, you have full control on your business, on your departments, and with the user management feature, you have all types of users. Everybody can be involved into this software. One thing to note, you cannot invite, and I repeat, you can't use the same email address to have multiple roles. So you invite a user, let's say from departments with an email address, the same user cannot have different roles. They cannot be a maintenance person, they cannot be a head office user, they cannot be an auditor. Why is that? Why is that? So with one email address, if you log in, the system has to know what dashboard to show you, what dashboard to display you. So if you try to, well, first of all, the system won't let you anyway. We had this, let's say, bug in the past where care providers invited the same user under a different role. And when you log in, the system doesn't know what dashboard to serve you. Are you a user from department? Are you head office user? Are you an auditor? So it used to get confused. But now we eliminated that. So one email, one role. If you want a user to have different roles, you have to invite them with a different email address. Okay, so let's go back to our um, dashboard side panel. So I'm going to start from the top now and go downwards. So we have single assessment, framework audits. I know CQC is in the process of changing this. We'll keep an eye and we'll make the changes accordingly. This is free to use. And by the way, I forgot to mention, any care provider can use um, the medication audit for free as a demo. So the medication audit is free to use for everybody. All you have to do is to create an account. Uh, you can have a sign up button here. You create an account and you can carry out the medication audit so you can see how the system works. And it's the same with the CQC single assessment framework audit. This is free to use. So you have the 5 domains. I have selected safe and I just go through the safe domain audit, answer all the questions. In total, there are around 240 questions. Once I completed everything, I click save and generate plan. AI will give me an action plan based on my answers, and the action plan is related to the safe domain. And I do the same, sorry, with caring, responsive, effective, and well-led. And the system here gives me a score separately for safe, caring, and so on. And then it gives me a combined score. This is a quick audit you can carry out to see roughly where your business is, how is your business performing. But really, the powerful features of the software sit here under audits and calendar. So let's dive into the audits. Again, I'll pretend I'm a care home, but it is the same principle for dom care or supported living. So I'm going to click on care homes. I have around 60 plus audits for care homes. And this is your clipboard version. We like to call this the clipboard version. You open it, you carry out the audit. So once you open an audit, and if you carried one before, it will show you the last instance so you can compare. Let's say I've done, well, we are in June now. Let's say we've done this in May. I want to carry out one for June. So the one I see now is the one that I've done in May. Now it's June. I can change the answers. But this will be a yes now maybe, so I can delete the previous notes. Leave this as a no. I simply go through the audit and click save and generate action plan. At this point, I cannot share tasks. I cannot upload evidence. And by the way, only click well, sorry, no. You can click save at any point because you can come back to audit. Let me show. I'm gonna clear these two answers. So I have not answered two of the questions, but still I'm gonna click save audit. It generated the action plan for question 3. And that's the only one that we failed, just checking, yeah, because these two have not been answered. So question 3 is the only one that we failed. Here, though, it says answered 38 out of 40. So you can come back at any time and complete the audit. You don't have to do everything in one go. Let's say next week I can come and carry on. I completed these questions too. I'm gonna mark this one as a no. And I'm gonna add a new note. So following hospital discharge or outpatient review, do records show medicines? I'm gonna say not always. And add the note. I'm gonna click save audit and generate action plan. Now I answered all 40 questions and I have 2 failed questions, and the action plan reflects this. Now, as I mentioned, I cannot do anything with this clipboard version here because this clipboard version has been pushed to the compliance calendar, and it says here, your audit has been saved. Visit the compliance calendar to action this audit. So first you make sure that you completed the audit for that month. Make sure that you're happy with your notes, with your answers. Every time you click save, whether it's these buttons do the same thing, whether you click save audit here or at the bottom, they do the same thing. But every time you click them, it overrides the audit in the compliance calendar, the final version. So let's say I completed the audit, I'm happy, everything is fine, notes. Now I'm gonna click take me to calendar, and it takes me to this compliance calendar, and I can see now all my audits. You can access the calendar through your dashboard. If I click here calendar, it's the same thing. So I just completed the medication audit for June. Now I can access it. Now I can edit the action plan if I'm not happy with AI's response, but in general, he's quite spot on. Then I have the actions Q3 and Q40. So these are the questions that I failed. Now I can manage them. I can select a department. As this is a medication audit, obviously it's going to be a care, nursing, and clinical, but you can name this department as you wish. I'm going to select a user. I've allocated this task to Suzanne. I'm going to give her a deadline till the end of the month. I can allocate another person if I want. I don't have another user, so I only added, this is a demo account, I only added one, so it says Suzanne already allocated. But if you add more users under this, to your account, you'll see them all here. You'll be able to allocate the same tasks to multiple users. At this point, I can upload my evidence, I can take pictures. So Suzanne will see the evidence that I uploaded. So if I want, so I carried out this audit. If I want, I can mark it completed myself, and it says completed by me, date and time. If I untick it, then Suzanne will have to complete the task. I do the same with next one. give her a deadline, upload evidence, take pictures. This take picture feature works even if you use the software in the browser. Once you tap it or click it, it will open your mobile phone, tablet, or laptop camera. So you can take a picture and upload it. I'm gonna go back to my dashboards. I'm gonna go to the same medication audit. And what I'll do, I'm gonna clear one answer, save the audit. Again, it will overwrite the previous version. I'm gonna go to the calendar, and now it says due. Why it says due? Because I have not completed it. So if I go to audits, again, medication, now it says in progress because I cleared question 1. It will only show completed if you answered all of the questions. I'm gonna complete the question, save again. And this is the clipboard version. It pushed it to the compliance calendar. I'm gonna go to the calendar, and this is where you open the final version, the version that you can edit and where you can manage the actions. But you can see it overrides this version completely. So if I go back to the clipboard version and I carry out a new audit, it will override the tasks. So I have to allocate the tasks again. My advice to you, um, only allocate the tasks when you are sure that you have the final version of your audit and you're happy with everything. Once you're happy with your audit, then you can allocate the tasks. If you carry out the same audit in the same month, it will override the task allocation. Okay, so the tasks have been allocated. Okay, so now I've logged in as Suzanne. This is a department user. If you remember, I said to you that they have a dashboard, and all they can do is see the tasks in those audits and complete the task. They cannot complete audits. So this is the medication audit I completed in June earlier, and I allocated 2 tasks to Suzanne. I'm going to open this audit. I can see it. Uh, and yeah, this is me. I'm going to say here, completed, add the note. So it says here, Suzanne added this note, completed. I can upload evidence if I wish to. Again, I'm going to mark this as completed. Add note. And if I go to my dashboard, the medication audit is now green in my dashboard because I have completed all of my tasks. I can now move on to the next audit and complete the tasks allocated to me. I'm going to log out and I'll log in back into the main account. I'm back into the main account. I'm going to go to the next section, next tab, which is the custom audit. You can create your own custom audits. Let me delete these ones. Let's say you're not happy with our audits. All you have to do is to add a title. And it says here questions on one per line. So question 1, question 2, question 3. I think you get the point, and you click or tap create. It created a medication audit. What it does, it creates a full audit and it preserves all the features that we use in our templates. Um, you preserve the scoring system. You'll have a scoring system set up automatically based on the number of your questions. You can see the yes, no, not applicable feature. AI generated action plan. This will be pushed into your compliance calendar as well, even if it's a custom audit. Let me show you. So let me generate action plan. Your audit has been saved. Visit the compliance calendar to action this audit. Take me to calendar. And now if I scroll down, I can see it here. It says here medication audit, and it even mentions that this is a custom audit, and this is the version I completed. I open it. So remember, that was the clipboard version. This is the full version. I'm going to open it, and I can edit the action plan, and I can allocate the tasks to my users, and add notes, upload evidence, or mark it as complete. That's the custom audit, really powerful tool. Even more powerful is the external audit. I like this one so much. So let me delete this example. So external audits, you can import any audits carried out by third parties externally. Gonna give it a name. So you're gonna say fire safety. I have a fire safety audit, so you can select the month, year. I'm going to upload my fire safety audit. This one. Now the generate action plan button became active. It says here status uploaded. You can upload PDF, Excel, and Microsoft Word documents. I'm going to click generate action plan. And AI is doing its work now. So it will pick up on all the failed areas and also all the recommendations. Sometimes you don't fail an area, but the auditor will offer you some recommendations. So the AI will pick up those. It will create an action plan combining the recommendations and all the failed areas. Based on the audit that I uploaded, this is the action plan. I failed quite a lot of questions or areas. Based on those, it created actions separately for each area that requires improvement. The same, the external audits preserve all the other features. You can upload evidence, AI action plan, and share the tasks with your team. And this is pushed into your compliance calendar as well, even if it's external audit. For fire safety, as far as I know, it's once a year. Um, so you can set the frequency every 2 months. Education audit, even if it's a custom audit, you can set its frequency. Trends. You will see the trends, the aggregated or overall scores per period in a period of time. So I selected care homes. I selected all audits. Date range is 12 months. So over the last 12 months, this is my average score month by month. So I can see how my care home performs. Or I can drill it down to a certain audit. So I can see, uh, I have the medication audit, I can see from December till June how my business perform in terms of the medication compliance or infection control. Again, you get the point. I forgot to mention everything can be exported as PDF, pretty much all the screens. You have this export button. I'm gonna open an audit. Here you have export, even custom audits, trends. You have the export button, so I can export this report. Let me show you how it looks like. I'm gonna click export. Yes, it's branded. Let's see. Scores, chart, a graph. Next, we have all actions tab where I can filter the actions by outstanding. So I can see all the outstanding tasks. These are tasks that these are tasks that must be completed by the end of the month or overdue. I have 15 actions overdue in 9 audits. I have completed. So I have 25 completed actions in 12 audits. Can export every single instance, every single report as PDF or all. If I select all, it will show me all the actions outstanding, overdue, and completed. And I can export this report. Very useful for monitoring and inspections, either local authority inspections or CQC. We have checks in beta. We introduce these 5 checks for now, but you'll see each week uh, new checks popping up in this section. So I'll show you the fridge temperature as an example. I can add an area. Maybe you have different levels in your care home or areas, different fridges. So in my setup is like this. I have the ground floor treatment room, first floor treatment room, and the main kitchen. So I can check the fridge temperatures. I'm gonna open the ground floor treatment room. Oh, let me go back just to show you how it works. So I can add an area. I'm gonna say second floor treatment room. Add it there. Staff access. So I can select which of my staff can carry out the fridge temperature check, and I can save the access. So ground floor treatment room. I'm gonna open it. In June, this is today is 3rd of June. I've obviously this is a demo account. I've not carried out any checks yet. I know I've done some for May, so I can go back historically and I can see the checks, the fridge temperature checks. You can see there is one in red, and this is because you have this in range column. It says no. All of the other says yes, the temperatures have been in range. This one it says no because the maximum was 12, 12 grades Celsius. You can see the target is between 2 to 8, and therefore this was marked as red. And you can leave notes, management inform, it can be anything. I can export as PDF the whole month, and you can see the fridge temperatures for the whole month. Now let me do it for June. Today is the 3rd current. I'm gonna say it's 4. Minimum was 3, maximum was 7. Automatically, it selects answer in range, yes. If I set the maximum to 10, automatically it says no. I'm gonna leave it to 7, no notes, time, after save. So what it means, after I click save, it will record the date and time. Stuff, I'm gonna add my name, click save. Please fill in all required fields before saving. Notes, actions is optional. Of course, yes. So because um, yeah, no, it actually it's not the notes. The notes are optional. It's the resets. I forgot to say yes or no. Have I resetted the temperature? Yes. As you know, every time you record the temperature, you need to reset the temperatures. Yes. And now it will let me say, well, for a moment I didn't know what's going on. So yeah, save. Now it says saved, and it recorded the um, time, and you have the date. And now I can export this, and it shows me the one entry. And yes, you can go back historically by year or months, and you can export them anytime because everything is saved. So these are the checks. Treatment room temperature, same principle. Rooms temperature, whether it's bedrooms, lounge, kitchen, office, it's up to you. You can add as many rooms as you want or areas, and the same you can manage the staff access. Um, and now we have the daily walk around checklist for the managers. You can add your site, your care home. I'm going to open it. And I just start my walk around, answer yes, no, not applicable. And it will save every instance. I've done one yesterday, which is in amber, its status, which means it wasn't perfect. I can export it as PDF or I can view it. I'm gonna click view, and I can see my answers. This was a no question regarding the unpleasant odors. I had a one not applicable. You can leave notes, you can allocate tasks from this. So yeah, this is the, so let me hide it, pending, hide. This says one entry. And this is once you completed your walk around, uh, you save it here, and it will save all the instances for the month of June below. And again, you can go back historically so you can see all the walkarounds. Maintenance, which is again in beta, in testing. You can, by the way, checks. Sorry, so again, the single assessment framework audit, it's free. In terms of audits, the medication audit is free. Anybody can use this for free. The checks is free. You can create an account, you go to the dashboard, and you can start using the checks today, free of charge, because this is still in testing modes. In the future, the next 3-6 months, we will eventually monetize these modules. So you'll be able to purchase the checks module separately. It's not going to be very expensive. You'll see quite affordable. The maintenance, you'll be able to buy this as a separate module as well. So how does it work? You add your site, so one site per license. When you carry out all these audits, surveys, checks, anything maintenance is per one site. Remember that one license, one site. I created my site here and the system. Let me delete it actually. Let me delete everything so you'll see how it works. Deleted. Let me refresh. Go back to maintenance. So it's empty now. It says here, set your account location. So again, I'm gonna set my um, location and click create QR code. The location has been created. Argyle House. It says here, this is the single maintenance QR code for this account / location. So you download this QR code and you can display this in throughout your care home. And by the way, I can't show them to you yet, but we can supply you with vinyl stickers, or there are some foam, not pads, um, little tubs, or I'm not sure how to call them, but they are made out of foam and they are sticky, and you can stick them on doors or walls or wherever. So your staff, your visitors, anybody can scan this QR code, and they will be taken to a page where they can report any maintenance issues. So it's either they scan the QR code or access this link. So if they scan the QR code, they'll be taken to this link, which is unique to your site. Let me open the link. So this is what they will see. Report an issue. Let's say a broken bathroom lights, broken switch. Sorry, switch. Location, room G12. Describe. You can add anything here. Broken switch in the bathroom or whatever. I can upload a picture or take a picture. My name optional. So I'm gonna add my name. Email optional. In case if it's something more serious, you can add your email so you can be contacted back. So you're a visitor, you're really concerned. The care home manager can send you an email and reassure you, look, this was fixed. Uh, thank you. Quite useful, I will say. So submit issue. Your maintenance issue has been reported, and it's here. It's a broken switch. The status is open. Location, date and time. I'm gonna log in into the maintenance account so you can see what they can see. And now I've logged in as a maintenance person. You can see the dashboard, maintenance dashboard, and it says one open issue, zero in progress, zero completed. You can see the broken switch. If I would have added a picture, it will be here. I can click on it and it will show in full screen. Now I'm gonna add a note. Switch fixed, or actually, let me say um, switch ordered, waiting for delivery. Uh, so I'm gonna save the note and mark in progress. And now the issue has been moved to in progress. I'm gonna click in progress, switch arrived and installed, save the notes, mark as complete. So now I have completed the task, or I can mark it again in progress or reopen it. Okay, so since I'm here as a maintenance person, I'm going to show you the entire dashboard. I can see any maintenance issue and manage them. I can see the compliance calendar. I cannot um, I cannot access any audits unless they are related to me. So let me show you what I mean. I can access the bed rails checks because this has been allocated to me. I can open it. I can allocate the tasks to other users, or I can complete the tasks myself. I can add notes. So this is the bed rail checks. I was wondering why. So if I go to tasks allocated to me, and this is the audit, so I have only one audit allocated to me, the bed rate checks. So I have an easy life apparently. So tasks, why is it still red or amber not completed? I'm going to open it. It's because I've not marked all the tasks as completed. Let's go back to the dashboard. If I go back to the tasks now, all actions completed. Audits, I can carry out this audit if I want to, as it has been allocated to me. And this is the support page. I'll log out and log into the main account again. I'm back to the main account. So we completed the maintenance module. Now I'm going to move on to the visitors log. So this is a module that will allow your visitors to sign in digitally. I added my site, which is my care home. Here I can turn the screen on and off the moment the screen is on. Now it's off, so I'm going to turn the screen on. I have this option open screen. So if I click it, it's either I click open screen or send this link to the tablet. So the way it works, you have a tablet at the reception, at the entrance of your care home, where there is a stand or a wall mount, or the tablet sits on a desk. So you send this link to the tablet, or you log in with the tablet and into your account and click open screen. So let's click, or let me send the link first to the tablet. You have this screen displayed on the tablet, and you have the full screen mode here. I'm going to click the full screen mode. So this will be displayed permanently on your tablet. The visitor comes in, taps the start, sign in, or in my, yeah. So enter the name, reason, and then complete the signing process. This is how it is at the moment. We might improve this screen. Again, this is in beta version, in testing mode. Complete sign in. Thank you. I'm now signed in. It will switch back to the start screen automatically after a few seconds. So you can see it defaults to the start screen. I visited my dad. I come back to the screen. I tap start. Now I'm going to sign out. So it says here, type at least 3 characters to search by visitor, name, or vehicle registration. So either I type in my name, it will find my record, or my vehicle registration, again, finds my record. I'm going to tap on it. Please confirm, sign out. I'm going to sign out. You are now signed out. Again, it will either I click back to start, or the screen will default automatically to the start screen. So let me close this. Today, this is your main dashboard, so you can see all today's visitors or currently signed in. At the moment, there is nobody signed in. If there is, you'll see a list of everybody that's in the building or all records. So you can see I've tested the account, all the previous records are in, or you can search by name, reason, or vehicle. What we will add probably in the future on the sign-in screen, we'll add the status of the visitor. So we'll add an option, relative or contractor. We'll add a few options so they select when they sign in, so you know what they are. So that's the visitor system. Surveys. All right, so in terms of surveys, you visit the surveys, you select what type of business you are. So if you are a care home, you select care homes, etc. So I'm a care home. I'm going to subscribe. First, you need an account. Then you subscribe to the survey. Once you subscribe and you're logged in, let me log in. You go to surveys, care home. You have 5 options. You have these templates, resident satisfaction for residential care, for nursing care, relatives and visitors, and staff member satisfaction survey. So you can create any of those, or, I mean, these are our templates, or you can create your own custom survey. You add a title, audience, an introduction, sections, and questions. Let me go back to the dashboard. I'm not gonna insist a lot on the custom survey. I have created a few. I'm gonna go to my surveys, and I have this staff member satisfaction survey. I have 5 responses. So if I click on actions, I can deactivate the survey. Let's say it ran for about 2 months. You can pause it, or I can completely delete the survey. I can copy the link and share it. Anybody that accesses the link will see the survey and they can start filling it in. They can optionally add the name. If not, it will be an anonymous survey. They can print the survey. If they don't want to do it digitally, they can print it and then hand it over to you as a printed version. Once they filled in the survey, they click or tap the submit feedback. Now, the way it works, all questions are marked from 0 to 5. So not applicable is not marked. So if somebody selects not applicable or don't know, this will not downgrade you. So this is, as I said, this is not marked. If they select very dissatisfied, this is going to be a 0, a 1, 2, 3, and 4. Sorry, I beg your pardon. So this is going to very dissatisfied. This will be a 1, 2, 3, 4, and 5. So this is how the scoring system works. Let's say they do it this way. They select answers. The system will automatically calculate the average score for my response based on my answers. There are a few sections at the bottom: overall experience, about you and your role. These are not scored at all. And these are optional. If the staff member wants to add these details, fine. If not, it will be completely anonymous. It's optional because based on these selections, they can be identified. If they leave them blank, they can be identified. But again, these are not scored. And then you'll see the responses here. So if I go to actions, I can click view responses. So I can see I have 5 responses. This is my average score. This is still active. And I can see all the 5 answers. I can see the name, if they added their name, their average score. So I can see this staff member, Jade Short, 1.7. She was really unsatisfied. I can click view full response and I can drill down to her answers and I can see all her scores and I can see all her comments. Everything can be exported as PDF as usual. I already mentioned that, but this is the powerful stuff. If you click view trends report for each survey, we introduced AI. So again, print, export as PDF. AI will create a report and you can export this and you can share this with CQC or stakeholders, local authorities, and so on. You can see some stats: positive, neutral, negative. So we have 81 positive answers, 4 neutral, 25 negatives. The surveys that we created, the templates are based, they are created on sections. So there is a training, supervision, and development section, leadership and management, teamwork, and so on. There are more sections. And this just shows the best performing sections in the survey. So where are we doing well? This is an AI executive report. If I click refresh AI report, it will generate a new report based on the answers in the feedback. We have to wait a bit. So executive summary, it adds a text, a brief text about this survey, positives, negatives, and recommended actions. More stats. So you can see very clearly the results, good trends, poor trends, and areas of improvement. You can see comments. Now also it creates you said we did or you said we will report. This is what they said. So it picks up the negative areas and this is what we did. I can edit this. So let me mark the completed one. Let me untick them so you see how it works. So I untick them. I'm going to publish. So it says, you said we will. You said we will. Picks up all the negatives. If I click edit and I complete this, it will change from we will to we did. So let me show you. Edit. I'm going to mark this as completed. Sorry, here, this one. Now it says we did. We will, completed, we did. So I'm going to publish. So every task that you completed already, it switches to completed. More statistics, more data per section. So these are the section I was talking about in the survey: training, teamwork, safety and quality of care, leadership, working in this care home. About you and your role, it says not scored, and overall experience. And we can export this as PDF. And yeah, this is a preview of how it will look like once exported. Okay, so dashboards. Let me close these. We completed everything, a part of achievements and support. So the achievement section, once you create an account, whether that's a free account or you paid for the audits, this achievement section tracks your progress. And we have 20 achievements at the moment. Maybe we will increase these as we continue building Care Audit Pro, but at the moment there are 20. Performance, consistency, achievements. So once you start, just to give an example, compliance champion, maintain an average audit score of 90% or higher for 6 consecutive months. Once you achieve this, this will be unlocked. Or audit specific, medication safety leader, maintain 90% plus in medication management audits for 6 consecutive months. Or safeguarding, improvement-based achievements, turnaround leader, for example, improve a domain score from below 70% to above 85. Or increase your overall audit score by 15% within 3 months. Anyway, I think you get the point. Once you unlock an achievement, you can download the certificate. And these can be displayed. They will be branded with your logo. Have the support. You can search articles by keywords, for example, invite user. And we have this article. You click on it and It tells you how to invite users, common mistakes, how to decide the right user. If you cannot find the right IT article, you can click the support chat and you can talk to our AI chat. This AI chat is again in beta version, it's still learning and we are still developing. It might not answer all of your questions, but if you reach a dead end with the chat will give your contact details, our phone number and email address, so you can contact us directly. The best way is WhatsApp. There is almost constantly somebody on WhatsApp that can answer your query, or you can uh, go to our contact page and fill in a ticket. So it's WhatsApp or ticket. So this is where we are at the moment with Care Audit Pro. We are um, developing it every day, every week to see new features, or the current features will be improved constantly. We'll add new audits, by the way. We are planning to add a marketing audit, so you can check how is your business performing in terms of marketing. This is just an example. We'll add more checks, we'll improve maintenance, we'll improve the visitors log, we'll improve surveys, and so on. Any questions that I've not covered in this video, let me know. Use the contact page, send us a ticket, or contact us by WhatsApp, and we are happy to answer all the questions. If you have any idea, any ways that you can think we can improve the software, the same, send us a message, let us know. We are more than happy to listen to any feedback, and we are welcoming any feedback. This is how we grow, this is how we develop so far Care Audit Pro, by listening to your fantastic ideas. Thank you so much and see you soon. Bye bye.